Hi, this is Anna Ferry, and I'm going to be doing my project on drug misuse and abuse. I will be talking about the negative effects on drug misuse and abuse, and they fall under 4 categories: physical, mental, social, and emotional. The first topic is physical effects. First off, the side effects of cocaine can include increased heart rate and blood pressure, but seizures, cardiac arrest, and even death are a real risk with this drug. Next, prolonged cocaine snorting can cause scabs to form on your mucous membranes, damaging your nasal septum, the thin wall that separates your left and right nostrils, and eventually make your nose collapse. Carbon monoxide, used in cigarettes, keeps red blood cells from getting the full load of oxygen needed for healthy cellular growth. This encourages the carcinogens in tobacco to bind to the cell throughout your body and cause cellular damage. And number 4, the greatest long-term risk of smoking is cancer and lung disease. Next are the mental effects. Though more common with LSD, all hallucinogens can cause flashbacks, feelings and thoughts that replay the effects of being on the drug weeks or even years after taking them. Hallucinogens are drugs that distort the way you perceive reality. They can cause you to feel and hear things that don't exist, making it hard to communicate or think clearly. Long-term effects of prescription depressants are insomnia and muscle tremors. Hallucinogens can cause rapid, intense emotional mood swings. The social effects are that when stimulants are taken over a long period of time, stimulant abusers run the risk of suicidal or homicidal tendencies and also experience cases of paranoia. Smoking pot at a young age can cause you to develop weakened verbal and communication skills, lowered learning capabilities, and shortened attention spans. Many people use drugs to go into social situations, as they believe the drugs can make them more secure, funny, pleasant, sexy, and clever. Drug consumers often appeal to delinquency or prostitution to satisfy their vice. The emotional effects of drugs and alcohol are 1. Taking hallucinogens can cause you to experience anxiety, fear, and paranoia, sometimes verging on psychosis, a complete loss of contact with reality. In this state of mind, it can be very easy to have a dangerous or even fatal accident. Continued use of cocaine can make you depressed, agitated, or manic. PCP can cause chaotic or confused thoughts. Cocaine can cause strange or even violent behavior. Next, I looked at major research facts. Ecstasy can be mixed or laced with virtually anything. This includes rat poison. The most commonly abused over-the-counter drugs include those that contain the ingredient DXM, dextromethorphan. The counter medications believed to help with weight, which is used to treat cough, cold, and flu symptoms. Also, over-the-counter medications believed to help with weight loss, like laxatives, diuretics, and diet pills, are often abused. All of these medications can have serious and potentially fatal side effects over time. Both liquid cough syrups and the tablet or capsule forms of medicine that contain DXM can distort your visual perception and damage your sense of judgment. Next, I looked up major statistics of drugs and alcohol. In the United States of America, the root cause for 25% of the total deaths can be attributed to drug abuse. 28% of school teens are aware of at least one of their friends who is a chronic drug abuser. 17% of them know more than one. Alcohol is a factor in approximately 41% of all deaths from motor vehicle crashes. I looked up some laws as well. One law is that it is against the law for you to possess alcohol on any street, highway, or public place, or carry alcohol in a car, or be a passenger in a car carrying alcohol unless accompanied by a parent or legal guardian, even if the container is sealed in the trunk. This applies to anyone who is under the age of 21. A court will order a 1-year suspension of your driving privilege if you are between the ages of 13 and 21 years old and are convicted of a drug-related offense. It is against the law to enter and remain in a bar without lawful business, to be under the influence of alcohol or drugs. The current programs that I found were like this number that you can call, 888-370-3232, and calling this number will help you to find a quality drug or alcohol program that fits your needs. So they specialize it, so they have someone there that you can talk to that will help you to specialize the program that you need. The number 1-800-448-3000, this phone number will answer any drug or alcohol related questions that anyone has. They are also there to listen to you if you need to talk about yourself or someone else who has any alcohol or drug related issues. The next program that I found was the Palm Partners Recovery Program. They help in treatment of drugs and alcohol addictions. The personal ideas that I had were to have the counselors of the school to talk to and be okay with understanding drugs and alcohol. Sometimes people go to them and are afraid that they'll tell on them if they talk about drugs or alcohol. If there's absolutely no fear that the counselor will tattle, then I think a lot more people would go to counselors if they need help or someone to talk to. Also, if we have more educational photos or personal accounts, we can more easily see what drugs truly do to you. You can't see what truly happens if we can actually visualize it. So in school, in wellness class, I believe that we should have someone to come in and to talk to the students, so maybe someone with a personal experience, so that they can understand, so that the students can understand what exactly a person of that nature goes through during their experience. I also believe that there should be longer rehab sessions. A usual rehab session goes for about a month, and to actually rid yourself of the addiction, I believe that the amount that you need is 6 months. So people aren't truly getting rid of their addiction when they leave the rehab center. If we have to extend the rehab session, I believe that maybe if we need to, maybe having more rehab centers around the country could help, so that we don't have a flood of people who need it. I also believe that in the wellness curriculum, we should have books incorporated into it. Over the summer, I read a few good books by a certain author who writes about her daughter and her experience with meth. They're all real-life books, and they're really fascinating when you actually get to listen to someone who's had this certain experience and who has seen it through her own eyes. Ways that I could help to make any of these ideas, make action on any of these ideas, I think that if I wrote to the counselors, maybe that could help. and to talk to them personally and have them to understand our personal view. For the educational photos and personal accounts, maybe if we went to any of the areas around, or any of the rehab centers around, or groups around, and talked to them about maybe having someone who they knew who was good with their personal experiences, maybe to have them come in and talk to the classes. Longer rehab sessions, the only way that I think that could happen is maybe writing to the government or writing to different rehab groups. Maybe even if the government could create a couple new rehab centers or something of that nature, that could possibly help. Books incorporated into the curriculum, well, I think that maybe if I talked to the wellness teachers and maybe had them have an idea about that. I don't know exactly how we could do it since books are not cheap, but maybe there's some way that we could do it. Alright, well, that's my presentation on drugs and alcohol. Thanks for listening.